Hello, my name is Marcos Patchett, the Nocturnal Herbalist, and in this video, it's the fourth, I think, possibly the fifth. I don't know, I haven't made the videos yet, but it's the latest in the series, in my series on medical marijuana or cannabis, and in specific its effect in cancer. Disclaimer at the top of the video, I'm not advocating the use of illegal drugs. This video is made for informational purposes only, and of course it can be used practically in areas of the world where marijuana is currently legal and particularly available for medical use. And in this video, I'm going to be talking about the use of cannabis in particular types of cancer. So its anti-cancer activity, whether there's any truth to that, what types of cancer it might be useful for, and whether we could use it that way as a sort of direct green chemotherapy, if you like. If you were going to attempt to use cannabis extracts to treat your cancer, you would need to be doing this in conjunction with your doctor, with your oncologist's blessing. This might potentially be done perhaps as a primary strategy in lieu of chemotherapy. So in other words, if your cancer was at a relatively early stage and your oncologist and your doctor felt it would be okay to try something experimental before chemotherapy was due to begin, you might negotiate that potentially with them. Or for example, if you're on the other end of the spectrum and your cancer had either failed, or somebody's cancer had failed to respond to chemotherapy, or perhaps only palliative, that is to say non-curative chemotherapy was on offer and maybe the side effects were very bad, this might be something you could try considering experimentally. Again, you'd have to discuss it with your physician, and preferably get a medical herbalist like myself who has some knowledge and information about dealing with using herbs in cancer on board. It's not my personal area of specialism, but it is an area of interest. So hence me doing these videos. Anyway, so practical use of cannabis in cancer. Again, this is all very hypothetical. I talked in earlier videos, in my first video, about the symptomatic use of cannabis in cancer, which is fairly well established now, that it means to reduce nausea in chemotherapy or to improve appetite and to control pain. But what I'm talking about in this video is the practical side of its use to actually control cancer. So potentially. So cannabis definitely does have anti-cancer activity. It definitely suppresses tumour cell growth, but all of these effects have been detected in vitro, which means it's Latin for in glass, and it basically just means in the laboratory, in test tubes if you like, or petri dishes or whatever, not in the human body. And that's significant because drugs can work very differently in test tubes than they can in the human body, in the laboratory, because in the human body they have to be taken orally. They're then diluted by the stomach acid and by saliva and whatever, and there are enzymes in there that may change their effect. The acidity of the stomach contents may change the chemical makeup of the drug. Then it gets into the small intestine and it gets all mixed up with bile and pancreatic enzymes, which may also affect the chemical composition of the drug. And then of course it all gets absorbed and taken via the hepatic portal vein to the liver, where the liver actually breaks it down and totally changes the chemical composition of most of the drug before it even gets into the bloodstream. And of course, to say nothing of the fact that the drug is more and more dilute at each stage. So not only do you have in the human body a process of increasing dilution, but you also have many levels of chemical transformation which may take place before any of those substances actually arrive at the target tissue, at the affected parts. So if you're applying a substance to cancer cells directly in the laboratory, it's very different from applying those in a therapeutic way in a living human organism. And that partly depends on how directly you can get that drug to an affected area. Say you have a tumour, well, if that tumour is on the skin, then you might be able to directly apply the drug to it, in which case some of those in vitro, in the laboratory findings might be highly relevant because you're applying the stuff directly to the thing. But if you're taking it internally, maybe the tumour is for example, in the brain, in which case the drug has to go all the way through your digestive tract, through the liver, and then got to pass through the blood-brain barrier, which is many, many levels of dilution and transformation and whatever, then the effects might be quite different from those observed in the laboratory. So this is the issue. A lot of the papers showing, and a lot of the research information showing an anti-cancer activity, yes, cannabis does have anti-cancer activity, but we do not know to what extent that actually translates to sort of in real life medical anti-cancer activity in a lot of cancers in the human body. Okay, so that's the first and most important thing to say. And the second and most important thing is, second most important thing, or just as important, the second thing, certainly, the second thing I'm going to say, is that we don't have human trials at the moment. We do not have human clinical trials of cannabis yet as an anti-cancer treatment for a variety of legal and political and financial reasons. Hopefully we will do, but we'll probably end up first with trials of some patented cannabis-based medicine, which is irritating to me as a herbalist, rather than the actual natural product which is freely available to people. But anyway, there's some complicated issues there which I'll get onto. But also the third thing to say is that there's no historical use of cannabis specifically for cancer. There's historical use of cannabis for some of the cancer-related symptoms, which I talked about in my previous video, such as weight loss or pain, but not to treat cancer. This is a relatively new use based on the laboratory findings. So the issue is one mainly of what's called bioavailability. How much of the anti-cancer substances in cannabis actually arrive at the tumour in a living human body. And what tissue concentration, so again, how much of those active substances get there? Does enough of them get to the actual tumour to make a difference? And are there additive or synergistic effects? Do the compounds in cannabis work together or separately? How does it work? There has been a preclinical in vitro trials, several. One of them looked at CBD, the cannabidiols extracted from cannabis, against human gastric cancer cells in the laboratory, and found they killed those cells by by causing oxidative processes. The reason that's relevant is because if you're taking antioxidants, such as other herbs or supplements which are antioxidant, and you're simultaneously taking CBD, let's say, for stomach cancer, just as an experimental thing, you might be negating or reducing the effect of the CBD. You might not be. We don't even know if CBD on its own is effective for treating cancer because we don't have the data. But this illustrates the complexity of the issue. It's not simple, but I'll be breaking it down for you in a moment into what cancers it might be effective for, what cancers we have some information for. The other thing to say is that pure THC, the main psychoactive or mind-affecting compound in cannabis, is not as effective as the mixed cannabinoids. That's like all the compounds. That's the cannabidiols, the CBD plus THC mixture seems to be much more effective at retarding the growth of or killing cancer cells in the laboratory than either THC or CBD alone. And this group, Baram et al., Baram and colleagues, conducted some really interesting in vitro in the laboratory experiments in 2019, links below, to check all this out. And what they found, and what they did, which was really interesting, they looked at different whole cannabis leaf extracts with different ratios of THC to CBD. And they found that, broadly speaking, the most effective cannabis extracts against all the cancer cell types they tested were ones with a higher THC percentage. So we're talking about THC levels, if I can find it, I think they said really quite high, over 30%, which is a very high THC level. So, but THC on its own was very weak. So it needed the CBD, it needed the cannabidiols as well. Where this is relevant, of course, is that many people now, because of the hype, are buying high CBD products over the counter with the THC removed from them to comply with legal restrictions in various countries. According to this in vitro study, they're going to be negligibly effective. The most effective killing cancer cells, again, in the laboratory, were these extracts which had high THC, but they had to be whole leaf extracts with CBD, with the cannabidiols in them as well. So just, you know, for anyone who is experimentally trying to use marijuana to kill their cancer, which I will discuss more in a moment, the first thing that you need to be conscious of is that you've got a variety of cannabis or cannabis extract which is high THC, a whole leaf extract which is high THC. It's more likely to be effective, at least from this in vitro information. The second thing I noticed from this was that differing cancer cell lines from the same organ could be affected very differently. What this means actually is that you can have, say, colon cancer, but colon cancer, there can be various different types, various different cell lines, which is why they do biopsies. You know, conventionally you'll go in, get a cancer diagnosis, and then they'll take a biopsy. They'll take a little section of that tumour and look at it under a microscope and determine what its cell type is. Now, the great thing is we do have a list of the cell types from this paper which showed which ones were most vulnerable to cannabis extracts, and particularly, as I said, the high THC whole leaf cannabis extracts. So I'm going to pop that table on the screen. All right, so just to talk about this table of cell lines and the anti-cancer activity of these whole leaf marijuana extracts, whole leaf cannabis extracts against the different cell lines. And remember that the maximum anti-cancer activity is found in cannabis extracts with a higher THC percentage, that's around 30% or more, with a good range of cannabinoids in as well. You can see at the top of the table, the top line, the HT29 cancer cell line, the type of colon, a type of colon cancer, cannabis was ineffective, so it didn't have any or very, very small activity against this type of cell line, which is why it's in red. All the other cell lines in the table, cannabis had some effectiveness against in the laboratory, in vitro. So we can see there's another type of colon cancer, the SW480 cell line, two types of lung cancer, that includes two different cell types, the adenocarcinoma and a non-small cell lung cancer type, two types of skin cancer, including a subtype of melanoma and a subtype of squamous cell cancer, two types of prostate cancer, two types of breast cancer, and that's very significant because we have one breast cancer cell line, MCF7, which represents estrogen receptor positive breast cancer. In other words, the type of breast cancer which is going to be sensitive to estrogen blocking drugs, chemotherapies like tamoxifen, but also very significantly, potentially, because this is a laboratory in vitro test, remember, the marijuana extracts were found to kill or reduce the growth of this MDA-MB231 cell line, which is triple negative, meaning these breast cancer cells are not stimulated by estrogen, not stimulated by progesterone, and not stimulated by Herceptin. What that means in English is that most of the conventional anti-cancer drugs don't work against them, so that's potentially very interesting. And then two different types of brain cancer were shown to be affected by marijuana in this table. So if you were planning to use cannabis for against a particular type of cancer, the first thing you need to check is that your cannabis extract actually is higher THC. You've either got a high THC whole leaf, a high THC resin, or a high THC extract. The pure CBD, while it may be helpful for some other symptoms like pain or anxiety to some degree, is not going to have very much of a anti-cancer activity if that's what you're aiming for. And by the way, it's the THC. If you watch the first video on the general medical properties of marijuana, it's the THC that does most of the pain-killing activity anyway. So you kind of want a whole leaf marijuana extract if you can get hold of one. And but if you were planning to use that experimentally, then you would need a high THC variety. The second thing is that you could use that table and see if you've had a biopsy done, if you can get the results from that biopsy and either give it to your health practitioner, your doctor or your herbalist or your oncologist, and ask them to tell you which cancer cell line, ask them to tell you or to find out which cancer cell line it corresponds with, then you can use that table that I just showed to maybe look and see if marijuana might be more effective, hypothetically, for the type of cancer that you have. Bear in mind, of course, that this table is based on in vitro, in the laboratory findings, not in the human body. So it's highly hypothetical. But if you were going to use medical marijuana, having this information and knowing what type of cancer you had, and if one of those types of cancer that you have, or that whoever you're prescribing for or whatever has, matches one of those cell types in the table, I would say it's more likely that it's going to be of some use, with the exception, of course, of that HT29 colon cancer cell line, which cannabis didn't work for much at all. So the second thing, if you're planning to use medical marijuana as an anti-cancer agent, would be you would need to decarboxylate it before using. What the hell does that mean? That means you've basically got to make sure that oxygen has acted on the marijuana to activate the cannabinoids in it. Now that happens naturally if you smoke it, but because heat, oxygen, like fire, causes oxidative reactions and that decarboxylates it. But if you're using medical marijuana internally, perhaps as an extract or as a resin or topically on the skin, you would need to decarboxylate it, particularly if you're using powdered leaf, for example. So to decarboxylate cannabis leaf, you would need to heat it to 105 degrees Celsius, that's 220 degrees Fahrenheit, for between 1 and 24 hours. So if you put your oven to that temperature, put the marijuana leaf on a tray, this is particularly appropriate if you're using a whole leaf or maybe even resin, spread it out on a tray and just heat it. Put the oven to that temperature, 105 degrees Celsius or 220 degrees Fahrenheit, and just heat it in there for about 1 or 2 hours, I think would be sufficient to cause oxidation and to activate the cannabinoids so that they actually have some anti-cancer activity. So is there any evidence that marijuana might have in real life anti-cancer activity? Well, there is, but it's kind of peripheral at the moment because there aren't human trials. There's that in vitro stuff, but from real life, there's one trial I found, link below, by I think Desai et al., Desai and colleagues from 2019, which shows that the prevalence of colon cancer or colorectal cancer in patients with Crohn's disease is an inflammatory bowel disease, and because of the constant inflammation in the gastrointestinal tract, patients with Crohn's disease are at higher risk of cancer in that area because inflammation is a risk factor for cancer. They found that patients with Crohn's disease who smoked cannabis regularly had a 0.3% chance of developing colorectal cancer, whereas those patients who didn't smoke cannabis had a 1.2% chance of developing colon cancer. In other words, 4 times less risk. In other words, relative risk reduction of like 75%. So 4 times as many patients who didn't smoke cannabis got colon cancer. That doesn't mean to say, by the way, that if you have Crohn's disease, you should smoke marijuana. You should read that paper because it shows that while the average hospital stay of Crohn's patients who smoked marijuana was less, possibly because of its pain-killing and anti-anxiety activities, they actually had more problems with bleeding. So mixed results. But in terms of risk of colon cancer development, that is interesting, because particularly as we've seen from the in vitro results, cannabis appears to have anti-cancer activity against some colon cancer cell types, at least in the laboratory. So once you've had a biopsy done, a medical person can help you determine whether the type of cancer that you or somebody else has might be amenable, susceptible to the compounds in cannabis. And then secondly, see if you can get those cannabis compounds directly onto the tumour. So you can't inject marijuana, because if you try just like making an extract of marijuana and injecting it, you're likely to end up in a medical emergency situation, because plant extracts are full of lots of chemicals, some of which, like tannins, for example, will cause hemagglutination, basically clot formation. They'll cause red blood cells to rupture. Basically, if you try and inject a crude plant extract, not good things will happen. So the ways you can apply it are, for example, topically, directly to the skin. You can swallow things, in which case they go through the digestive tract and get transformed and diluted. Or you can, in some cases, inhale them, vaporize them. So these routes of administration will introduce cannabis at different different balances, different combinations of pharmaceutical compounds from cannabis into your system and to different parts of your body. So let's go through that. Top of the list, if you have a skin cancer or a tumour which is visible on the skin, you absolutely, hypothetically, can apply a cannabis compound to that tumour directly. So you would want, again, to be using a whole leaf preparation. So I would say here you would, and again, remember that, as I discussed in previous videos, cannabinoids are fat and alcohol soluble. So you'd want to be making an ointment or a fatty preparation. You could create cannabis oil, for example, or an ointment using cannabis leaf, using lots of fats to apply it to the surface of a tumour. You could even sprinkle powdered cannabis leaf on the surface of an exposed tumour and poultice it with a little bit of say, castor oil. And of course that would depend on if the tumour surface was bleeding and maybe prone to infection. You wouldn't want to do that because introducing bits of powdered herb into an open wound, not a good idea. And same with an ointment, you want to be a bit careful, but you could, in that case, perhaps you could, what would be a good way of doing it? You might be able to poultice, you might still be able to use an ointment if you clean the wound very well, and you might still be able to use powdered herb if you wash the wound very well and wash the powder out and change the dressing twice a day, for example. Next level might be, let's say, prostate or rectal cancers, that's cancers up the back end. You could make a suppository. That's a medicine that can be inserted into the back passage, and that might get directly in contact with the lining of the rectum and the prostate. So that again might be expected to have direct activity on tumour cells there. And it would also have some systemic activity, because remember, it's going to be absorbed into the bloodstream from there, so it will affect you. Next thing, lung cancer, probably the best option would be vaporization, low temperature vaporization, not burning, not smoking it, but it would be best, if you're planning to try that, to invest in a electronic vaporizer which heats the cannabinoids up to the vaporizing temperature but doesn't create lots of combustion products, doesn't burn it, because you don't want the tars which clog your lungs up and may impair your breathing and which are themselves slightly carcinogenic. You want just the cannabinoids. So you want a good electronic vaporizer if you're going to try administering cannabinoids to the lungs for the purpose of attempting to suppress the growth of lung cancer cells in the lungs. For the Stomach, I'm sort of going down the list of like top of in terms of which things you can get directly at. So we've got skin, things on the skin, you can apply the cannabis straight onto them. For the rectum and the back passage, you've got suppositories, then the lungs you can vaporize. Then the stomach, of course, anything you take orally is going to be diluted by saliva and by stomach acid, but still you can take it orally for that, and there will be some direct contact with cancer cells or tumours in the stomach. And CBD on its own, even without the THC, had some activity against some types of gastric cancer. So I'll put the link to that bit of research below. That means that even if you're in a place where cannabis, the drug, is illegal, you can still purchase over-the-counter CBD extracts. And this is one of the cases where the CBD stuff will likely be helpful in certain types of gastric cancer. So have a look at that paper. That might be something that'd be worth trying. Finally, breast cancer, again, topical application. So as an ointment or as a poultice might be helpful. But of course, if the tumour is breaking through to the skin, that's already pretty advanced, but you can apply it directly. If it's under the skin, then again, it might not be super effective. Any cannabis extracts you apply to the skin, you want to put them in fatty media, meaning in an ointment with some fat or grease in it, because that will help the cannabinoids penetrate the skin. If you're just wetting them, that's not going to work. Same as if you're taking cannabis orally, you want to be taking a tincture, that is an alcohol-based extract, or you want to be using the powdered leaf or resin mixed with some sort of oil or fatty liquid, or even an emulsion, meaning a water-fat mixture such as full-fat milk or full-fat coconut milk or almond milk. Any kind of fatty milk product will do. Because the fat will help to dissolve the cannabinoids and get them into your system. A cannabis tea made in water just isn't going to do much because the cannabinoids aren't going to be very well extracted into it. Okay, and then the very last, the hardest one to get to is the brain. Cannabinoids do get to the brain, obviously, because we know that, because cannabis has a psychotropic effect. So smoking may be somewhat effective. I would recommend both smoking, as in vaporizing the cannabis, and sublingual drops. In other words, making an alcoholic tincture as concentrated as possible and administering these under the tongue. Now, bear in mind that the most effective extracts of cannabis, as discussed in the previous video and as mentioned earlier in this one, are going to be the higher THC varieties, which means they are the varieties which get people high or stoned. So for somebody who is cannabis naive or has never used it before, you really want to start with a low dose. I mean, this isn't so problematic for anything on the skin, any poultice or cream for skin cancers or whatever, or for visible tumours. But if you're taking a suppository, so it's getting into the bloodstream through the rectum, or you're taking anything orally, or if you're smoking it, you really, particularly if you're having it as a suppository or orally, because with smoking it, you tend to get a fast effect, but you can judge the effects more readily. When you're taking it orally or sticking it up your back end, once it's in you, it's all in you, and there's nothing much you can do about it. It's harder to judge the dose in terms of its effects on your mind. So I would caution anyone, even though you might think, I want to take a huge dose because I've got cancer and I need to sort it out. Firstly, as I've said many times in this series of videos, we don't actually know how effective this would be in real living humans. We know that cannabis extracts have some anti-cancer effects, so you can reasonably expect there may be some benefit in addition to their symptomatic benefits in some cases. But it's very experimental in the first place, and secondly, you just don't want to overdose on THC. It's not pleasant. In other words, always start with small doses if you're taking any form of cannabis orally or rectally. And that goes if you're naive to it, if you're new to it, if you've never used cannabis before, or even if you're an experienced smoker, because if you have, or somebody who's regularly used it recreationally in the past or currently, you just want to be very cautious and build up gradually. Also, just a word of caution, if you take cannabis orally, say you have a cannabis tincture, for example, you take a few drops of that orally and you think, oh, it's not doing anything. Say maybe you've got nausea, maybe you're taking it to help with cancer, but maybe you're also taking it for symptomatic reasons and you think it's not doing anything for my pain, and my pain is just as bad, or I still feel sick. Don't wait just an hour and then take more. Cannabis can take 2 to 3 hours sometimes if you've eaten to be fully, to sort of fully kick in. And it also builds up in the system. It hangs around in the system quite a long time. So what I would say is don't take a dose more than twice a day max, if you're taking it orally or rectally, and gradually build up the dosage. So if, say, you have a tincture and 3 drops aren't doing anything, the next day try 4. Don't, like an hour later, take 10, because you might sorely regret it. Really, ideally, what I'd advocate is that you find an experienced herbalist or practitioner who can supply you with a good medicinal grade, high THC cannabis variety, and of guaranteed quality, which isn't covered in pesticides and gubbins, and just, you know, go from there. Basically, don't. I can't give all the specifics in this video because there are so many different cannabis varieties available with so many different variations in constituents. But if you get a medicinal grade cannabis supplier, if you find a medicinal grade cannabis supplier, they should be able to tell you about the THC CBD variant, that the ratios in their different products and the concentrations, and give you a starting dosage if you're taking it internally, either vaporizing it or taking it orally. And so just start with the lowest dosage and work up if you're taking it orally, or even rectally. That's what I'd recommend. I've done a little flowchart which I'm going to put on the screen. Now this is what I call, as you can see by the title, my decision maker flowchart for using medical marijuana in cancer, brackets hypothetical, meaning this is all very experimental. But we start with, are there any contraindications for the use of cannabis? And if you haven't watched it, please do watch my video on medical marijuana and contraindications, which I'm putting the link on the screen for now. And if there are contraindications for its use, clearly do not use it. Avoid using cannabis as a medicine. If there aren't, do symptoms or the treatment indicate cannabis? What I mean by that is there any nausea? Is there pain? Is there weight loss? In which case the symptoms might indicate cannabis. And the treatment I'll discuss in a minute. Cannabis is quite compatible with 2 sorts of treatment. But remember from my contraindications video, it's not compatible. It's decidedly incompatible with immunotherapy. So if you're taking immunotherapy, cannabis is out as a treatment, okay? But even if the symptoms don't, there's a dotted line to avoid using cannabis, because that's not necessarily a don't use it. It's just, it's less likely that you might want to use it. You could still try it as an experimental treatment for your cancer, so long as you discussed it with your doctor, with your oncologist, with your medical team, but it's perhaps less indicated. And then, assuming that maybe symptoms do say yes, or possibly even if they don't, but more so if the symptoms do indicate that you would benefit from it, say if you've got pain or weight loss or poor appetite, then is there any evidence of the effectiveness of cannabis for that tissue type? Now again, if there isn't, that doesn't necessarily mean that you can't use it, because it would, if it benefits your symptoms, then of course you could still use it as long as it's legal where you are and all the rest of it. But if there is evidence for its effectiveness, again, that tissue type, that's a much firmer indication that you might want to try it. So what I mean by that evidence, the table showing what cell lines and cell types of cancer cells, cannabis appears to be active against, at least in the laboratory. And remember, as I keep repeating, that is a higher THC, those are higher THC varieties of cannabis, with the exception, one that isn't in the table but that I have mentioned, of a pure CBD does seem to be inhibitory against some types of gastric or stomach cancer. Okay, so if there's evidence of effectiveness for the tissue type, that's a firmer indication that you might want to try it. But as I say, for you, it doesn't mean that if there isn't, because remember, absence of evidence isn't evidence of absence, meaning we don't have enough information yet about cannabis's effectiveness against particular cell lines, let alone its effectiveness or lack thereof in the human body. We need actual trials. But anyway, this little flowchart is just a suggested sort of decider for helping you decide whether cannabis might be useful. But particularly the first thing to check is whether there are any contraindications for you. So please do watch the video on contraindications for marijuana use in medicine and in cancer. Okay. The last thing I want to talk about in this video is the combination of cannabis with chemotherapy or radiotherapy. And there was a good little paper, which I'll put the link for below, produced by Pellati and colleagues in 2018, which showed that administering a combination, I think in this case they didn't use whole leaf cannabis, they used a combination of CBD and THC, the isolated cannabinoids, but combinations of those administered to patients who are about to undergo radiation or radiotherapy showed that if they were given cannabinoids before radiotherapy, the cannabinoids increased the effectiveness of the radiotherapy. So that is very promising, because it means that at least in terms of radiotherapy, cannabis might be a decided advantage. It might be not just symptomatically helpful, but it might actually augment the effectiveness of the radiotherapy treatment. So again, we need more information about, does that vary with different cancer types? I suspect it would. But given the in vitro or in the laboratory work of Baram and colleagues, a higher THC variety might be useful in that respect. Remember, higher THC, but with the CBD, with the cannabidiols as well. There was a second trial by Bar-Sela and colleagues. I haven't written down the year. I think that might be 2019. I'll put the link below, showing that when cannabis was used by patients during chemotherapy, they used it as not to increase the effectiveness of chemo, but just to relieve side effects, so nausea and weight loss principally, but also possibly in some cases pain. They had an improvement in executive functioning, meaning their brain function actually improved, which is really interesting because, of course, one of the side effects of cannabis, particularly THC, is that it impairs short-term memory. But during chemo, it actually improved their executive functioning. That means their ability to make decisions and think more clearly, and actually objectively reduced their symptoms of fatigue and sleep disturbance, as well as improving their appetite, which of course is one of the indications of cannabis. There was no improvement in overall cognitive function compared to placebo over 3 months, but there was no detriment either. In other words, the cannabis for patients using standard chemotherapy had generally slightly better thinking, clearer thinking, reduced fatigue, better sleep, improved appetite, but otherwise not many other differences in terms of their thinking. But that's a positive result. That's good. That's a pretty low side effect profile and some benefits, some fringe benefits. So as far as we know at this point, with the limited clinical information that we have, cannabis hypothetically combines pretty damn well with radiotherapy and fairly well with chemotherapy. it definitely does not and doesn't combine well with and shouldn't be combined with immunotherapy. Okay, so hopefully this video made sense. I feel like I'm getting a little bit more incoherent as my videos go on, but that may just be me. Anyway, hopefully it was useful. The information in this video is useful. If you liked it, please subscribe, like, share, do all that, and catch me in the next one. All right, thanks for watching. Bye.